Hi, everyone. Uh, excuse me. I have to apologize because I do have a little bit of a tiny laryngitis. Um, excuse me. I am we're starting our first journal club right now, and I am just trying to get Rebecca Jones, who is presenting the first article, onto the video. So, hi, Jillian. How are you? Tonight we are going to be going over the first article. It's the first of 42 articles, so this is quite a big endeavor, but we are going to be going over all 42 of the articles that the ABPN has put out for the MOC pilot project. This journal club is going to be for anybody who wants to learn. It doesn't have to be for just people doing the pilot project. And hang on one sec, I'm just trying to make sure Rebecca can get in. Hi, Fatima. And yeah, this is for anybody who wants to learn and anybody who wants to get free CME. The American Physician Institute, who has so generously provided our CME this year for all the live videos that we've done, is also providing the CME for this journal club that we're doing.
Hi.
Hi, how are you?
Good.
Hi, how are you?
Good.
Good.
Everybody.
Huh? Okay.
How's
I cannot hear you. You are fading out. Can you hear me?
Yes.
Okay.
Yes.
I don't know what that is.
Okay.
Let me turn it off. Turn back on. Okay.
That you're off. So we did practice this, I promise. But let's just wait a moment and get her back on. So as I was saying, we have this really big endeavor of going through all 42 put out by the ABPN. And I think this is going to be, hi, Kamna. I think this is going to be quite the project for us. So we're going to be going every Monday and Wednesday evening at this time, 7:30 p.m. Central Standard Time, which is, I just go by Central Time because that's where I live. And we basically are just going straight through until we finish all the articles. Today is the first one for anybody joining us.
Hi there.
Hi. Okay, I'm back and I can hear you this time. Sorry.
You can hear me okay?
Okay.
Okay.
Okay. Can every Okay.
No one's saying.
Go ahead. I just want to let you guys know she is from Alabama, trained at University of Birmingham. She works part-time hospitalist in Alabama, covers 2 units. One is a long-term for patients here been committed to this facility, and is an acute one psychiatric patient. She also has an outpatient in suburban Birmingham. Her outpatient is psychiatric patients and we will just get, and Rebecca's just going to and get through the article this about 2 minutes. A link at the top where you can go to free CME and claim free.
All right. Are we ready?
Yes.
Okay. If you guys have any difficulty hearing me, let me know. So I went through the review article and I put it in a little different order as to what made sense for me. So if y'all are following along with me, just know that there are going to be some things that are not quite in order to the way the review article goes. So the authors are Tang from Texas Tech, Tang from WashU. Whose voice is muffled? Is it mine or Christina's?
I'm feeling it was, you seem clear.
Okay. Tang from WashU and Posner from the University of Oregon. There were no conflicts of interest regarding to the financial disclosures, and this is a review article. So some of the background information, there are several core clinical symptoms of addiction, and one is enhanced incentive for drug taking, so cravings, impaired self-control, so that's the impulsivity and the compulsivity, emotional dysregulation or negative mood, and then increased stress reactivity. And as far as the brain structure goes, the neuroimaging studies have shown that the ventral anterior cingulate cortex and the medial prefrontal cortex are mainly associated with emotional regulation. So they looked at mindfulness meditation for this particular review article, and they were looking at mindfulness meditation as a way to address the clinical symptoms of addiction. And they defined mindfulness meditation as a non-judgmental attention or regulation to the present experience. So kind of taking whatever is going on in your life, and even if it's negative or positive, just kind of having a neutral view of it. So studies have shown that mindfulness meditation leads to increased positive emotion and decreased negative emotion. Most of the studies that were talked about in the review article, the type of mindfulness meditation that they did was something called integrative body-mind training. And they describe that as a systematic training of attention and self-control with an attitude of acceptance and openness to both internal and external experiences. So for the purpose of most of the articles that we're going to be going through, there was a control group, and the control group had relaxation training, but they really did not really do any further description of what that relaxation training was, except that they said it was most often used as part of cognitive behavioral therapy. And then they kind of make some important notes during the article that I'm just going to make at the front. Number one is that emotional regulation is not always deliberate. There is unconscious or implicit emotional regulation. And then there is evidence to suggest that even brief training for mindfulness meditation has positive effects on the brain, both structurally and functionally. Okay, so most of the articles they reviewed were written by Tang et al. So we're going to kind of go through those one by one. Okay, so the first one was done in 2007, and they did the IBMT and the relaxation, and the IBMT groups were shown to have a lower negative affect and fatigue and higher positive feelings on the profile of mood states. I might refer to that as POMS going on down the road because they use this measurement scale frequently. And the interesting thing that came out of that article is that even a few mere hours of IBMT were shown to decrease the levels of cortisol and increase immune reactivity. So then in 2009, the same group published a study. They did a randomized controlled trial of 46 undergraduates. They were given IBMT versus the relaxation, and then they had neuroimaging done both before, during, and after 5 days of training. And the results were that the IBMT group had stronger subgenual and adjacent ventral ACC, or that's the anterior cingulate cortex activities, and that these areas are linked to the autonomic nervous system. The IBMT group had significantly improved high-frequency heart rate variability. So I had to do a Google search for that one. And thanks to the University of California at San Francisco, heart rate variability refers to the beat-to-beat alterations in heart rate. So basically under resting conditions, we have kind of a normal variation, and we'll have cardio acceleration when we breathe in, and then cardio deceleration when we breathe out. So they feel like they call this respiratory sinus arrhythmia, and it's predominantly meditated by parasympathetic activity to the heart. So basically what they do is they do an EKG, they measure this R to R interval, and then it's variability. So there you go, now you know. So the third study was Tang et al. In 2010. They took 45 U.S. undergraduates. They were given either IBMT or relaxation. And then they did neuroimaging with diffuser tensor imaging, and they did this both before and after the study. So if you pull up figure 2, if you are following along with us, if you look at figure 2, you'll see that 10 hours of IBMT within a 4-week period resulted in increased fractional anisotropy, and if you'll stay with me, I'll explain that, to the corona radiata, which is a white matter tract that connects the ACC to other structures. So after 2 weeks, they found reduced axial diffusivity, which they feel like correlates to axonal density. And then after 4 weeks, they found decreased radial diffusivity and decreased axonal density. So they feel that this suggests improved myelin and decreased axonal density. And the bottom line was that this suggests that there is improved efficiency of the white matter after 10 hours of IBMT as mindfulness meditation. Okay, so then in 2012, they did another randomized control trial, IBMT versus relaxation again. They didn't say how many subjects were included in this particular review article, but again, the imaging was done with DTI. So if you will look at figure number 1, this looks at the POMS that I was talking about. And the IBMT group showed decrease in anger, hostility, confusion, bewilderment, depression, dejection, fatigue, inertia, and total mood disturbance. So then if you go look at figure number 3, which I think is on the next page, figure 3 shows decreased axial diffusivity in the left posterior corona radiata. So that suggests that the mood changes that we saw in the previous figure for the POMS correlated with the anterior cingulate cortex's structural changes. So sometime between 2012 and 2013-14, it looks like there was a literature review done by Brewer et al. And there was, the review article was a little bit critical of the lack of randomization and kind of weak controls within the body of data on this particular topic. So in 2014, there was a study published by Bowen et al., and it had 3 groups. So the first group was treatment as usual, and they don't say what that means, just whatever that is. The second was CBT-based relapse prevention. So that was a CBT-based group therapy, 8 weekly sessions. And then the third group was a mindfulness-based relapse prevention, and it was obviously mindfulness-based, and it was 8 weekly group sessions. So the results were pretty interesting. At 6 months, both groups showed a decreased risk of relapse to substance use and heavy drinking. And among those who used substances, both groups, so that's both groups being the CBT and the mindfulness group, showed significantly fewer days of substance use and heavy drinking. The CBT group did have an advantage at the 6-month time mark where they had an increase in length of time to first drug use. So then at the 12-month follow-up, though, the mindfulness-based relapse prevention group showed significantly fewer days of substance use and significantly decreased heavy drinking compared with the CBT-based group and treatment as usual. And so the CBT group didn't have the same benefit at a year. So then if you go to the next study, which is Tang et al., and it's 2013. So this is kind of, if you look at that abstract at the very start of this review article, I was a little bit confused as to what that is for, but it's actually for this study. So I've synthesized some of the data from the start with this data, and we're just going to kind of go through this particular study. So the target symptom was impaired self-control. And the brain areas that they thought were going to be involved were the anterior cingulate cortex and the adjacent medial prefrontal cortex. So they basically recruited people who desired to reduce the stress, and they did not ask about substance use during recruitment. So then they had people who signed up. They did a series of randomized control trials. They tested whether or not increased prefrontal cortex activity was related to better self-control in executive functioning, emotional regulation, and stress response. And so they took populations of patients and they broke them down into healthy or addicted. And the substance studied was tobacco. So this is the only thing, like when I read the original title of the article, I was thinking more illicit drugs, but this was actually tobacco. So the control group had relaxation therapy, the treatment group had IBMT, and they had really 3 different measures. So the first measure was of emotional regulation, and they did the profile of mood states, the POMS, and they did the positive and negative affect schedule, the PANAS. And then for the stress response, to evaluate that, they did salivary cortisol. And then to look at the brain structure, they did a functional MRI. Okay, so the results. So prior to the IBMT, I guess the baseline functional MRI, they found that the smoking group had decreased activity in the ACC and the PFC at rest. So they kind of view this as a way to visualize the association between impaired self-control and addiction, but they just kind of wanted to make the note that the deficits that were there did ameliorate with the IBMT training. So there's the good news. So after 2 weeks of IBMT training, they did 5 hours total during 2 weeks. These are some of the results. So in the smokers that had IBMT, 60% of those reduced their tobacco usage. 30% of those quit smoking altogether. So they said that they measured this both objectively and subjectively, and the objectively would have been by measuring carbon dioxide in the lungs. So as far as the structural results go for smokers who had IBMT at the 2-week mark, go to figure 4. So if you look at figure 4, you'll see that the functional MRI after 2 weeks of IBMT showed increased activity in the ACC and the medial prefrontal cortex, and the p-value was less than 0.05. So furthermore, the IBMT group of smokers also had a decrease in cravings of tobacco as compared to the relaxation group. So if you look at the smokers that were in the relaxation or control group, there was no reduction whatsoever in tobacco use. Both smokers and non-smokers in the IBMT group showed improved emotion regulation and stress reduction, and those changes correlated with the increased PFC activity after the training. So kind of the other important notes about this particular study is that they measured intention to quit smoking and found that conscious intention did not make a significant difference in smoking behavior. So they have some thoughts and conclusions about maybe why IBMT might be helpful for addiction. One is that decreased cortisol may improve response to a stressful situation and therefore decrease addiction. And the other is that the practice of mindfulness might lead to this non-judgmental stance, kind of awareness and acceptance regarding their addiction, where they can make some maybe better choices for themselves without having some self-loathing and other negative emotions involved. The self-loathing, of course, is my words, not theirs. So just to recap, there are some key points. So the 4 clinical symptoms of addiction, the 4 core clinical symptoms are enhanced incentive for drug taking, also known as cravings, impaired self-control, also known as impulsivity or compulsivity, emotional dysregulation or negative mood, and increased stress reactivity. And then the anterior cingulate cortex and the medial prefrontal cortex are implicated in self-control. Decreased activity in these areas is associated with impulsivity and poor emotional regulation, and increased activity is associated with improved emotional regulation and decreased impulsivity. That is all I've got. So I have no clue how far we are in time-wise.
Very good. I think I'm...
Yeah, I can't hear you. Any questions, anybody?
What's that?
Anybody have any questions? Well,
okay. Well, I think we should end sweet.
All right. I'm going to sign out. Thanks, Christina. Bye, everybody.
Bye.